Summer. Today we're going to be assessing the GI and renal system. We're going to go ahead and start with the abdomen. We'll bring the camera down a little bit. First, we're going to inspect the abdomen. You're going to make sure that the skin is intact, the color is normal, that it's pink, that you're not seeing any mottling anywhere. You're going to look to see if there's any obvious pulsations in the stomach, if there's any movement anywhere, which would be peristalsis. You'll notice this more in very thin patients. You're going to make sure that the abdomen is symmetric in all quadrants and there's not any fullness above or below the umbilicus. Next, we're going to go ahead and auscultate bowel sounds. You can start in whatever quadrant you want to. You just want to make sure that you go in a clockwise manner. When you're listening to bowel sounds, you want to do it with the diaphragm of the stethoscope. When you're listening, you're going to listen for the first sound and then you're going to start counting seconds when you hear the second sound. If the bowel sounds are between 5 and 15 seconds, this is normal bowel sounds. If it's more frequently than every 5 seconds, this is considered hyper bowel sounds, and then more than every 15 seconds in between bowel sounds is considered hypo. For someone to have no peristalsis or bowel sounds in a quadrant, you must listen in each quadrant for 5 minutes. So we're going to go ahead and listen with the diaphragm in each quadrant. So left upper quadrant, left lower quadrant, right lower quadrant, and right upper quadrant. Next, we're going to listen to the arteries that are involved. We're going to listen to the abdominal aortic. We're going to do the renal, and then iliac and iliac. We're listening for bruits. We're going to do this with the bell of the stethoscope. If you hear a bruit in any of these areas, you need to go back and listen to the heart. There may be indication that there's a murmur that you didn't pick up on the first time. So we'll go ahead and listen to those. Aortic, renal, renal, iliac, iliac. Next, we're going to percuss in each of the quadrants. Again, you're going to do this in a clockwise manner. The normal sound that you hear with percussion is tympany in the abdomen. If you hear another one, which is dullness, that may indicate that there's a stool impaction, maybe the liver's enlarged, or there's a mass somewhere in the abdomen. So we're going to go ahead and percuss. With obese patients, you may need to percuss more than once in each quadrant to get a full exam. So we'll go ahead and percuss. Next, we're going to palpate each quadrant of the abdomen. When you're doing palpation, you want to make sure you can see the patient's face. They may tell you that they're not having any issues or any pain in their abdomen, but by looking at their face, it can tell you other things. You're going to start with a light palpation in each quadrant, and that's just going to be with your fingertips. You're not going to push down any more than a centimeter. You're going to be feeling for the tone of the muscle, see if there's any tenderness there or any masses. So we'll go ahead and start with that. Any tenderness? Any tenderness there? Okay. Next, we're going to do a deep palpation. Again, we're going to go in a clockwise manner. You're going to put your non-dominant hand down, and then with your dominant hand, you're going to push down, push away, and then pull back. Again, you're checking for muscle tone. You're checking for any masses or any tenderness. Any pain or tenderness? Good. That's all for the abdominal region. Now we're going to check for CVA tenderness on his back. If you'll go ahead and sit up and face the other wall. With CVA tenderness, you can do direct or indirect. You're just checking the renal system to see if they're having any pain. If they do have pain, then you know that you need to further evaluate the renal system. When I tap on your back, just tell me if you have any pain. Any pain in either one of those areas? Okay, that completes our assessment of the GI and renal system.